Hey guys, hope you guys are having a great day. It's Dr. Ruth Roberts. We're having an extremely exciting time at the house because somebody came. Gracie and Esau are settling back down, and over there in the side, I don't know if yeah, there they are. Romy and Pepe are chilling out. And then Moose is a super happy boy on the sofa, so he's having a great time. But yeah. The UPS guy came, so everyone is extremely excited because he brings them bones and stuff. So let's see if we can chill these guys down a notch or two. And settle, buddy, settle. Esau has to say the most because he's the biggest boy. Hey, guys, settle. It's okay. So hope you're well and everything is going well for you and your pets. Today we've got a couple of interesting things to talk about. We've been, I think I told you a few weeks ago about a course that a friend of mine, Dr. Rob Silver and Dr. Gary Richter, put together about medical marijuana for pets. This is getting to be a huge thing on the human side, and in states that have had marijuana that is legalized. The fascinating thing is that they have reduced the numbers of prescriptions dispensed, or they've seen a reduction in the numbers of prescriptions dispensed for pain medication, anti-anxiety medication, sleep aids, and medication for depression, to the tune of something like $1.6 million in two states. So, so that's California and Colorado, I believe, were these two states that were being reported on. So the interesting thing is that in the human literature, they're continuing to say, well, there's no real benefit that's been documented for marijuana for humans, but yet the number of scripts are going way down. So that's fascinating to me. There's a lot of folks that, we've got so many pets out there that have chronic pain issues that are just in misery, and we're doing everything we can to help them, as far as whether that's in a conventional approach or whether it's a combined approach with integrative medicine, so using things like acupuncture, herbs, nutritional supplements like fish oil, turmeric, things of that nature. And still, sometimes it's not enough. So the thing that really kind of caught my eye with this was I had a client whose dog inadvertently ate some pot candy that a friend had given a friend who was taking care of this dog. That gets a little convoluted because that person had Parkinson's, and so she was looking for some relief for her symptoms. And what was fascinating is that it was a scary situation initially because the amount that my friend's dog ate was too much, and he became very toxic and out of it. Thankfully, in most cases, if the doses are relatively small, with just supportive care, meaning, keeping them warm, intravenous fluids, turning them over, helping them go to the potty, that kind of stuff. These guys get through most episodes of marijuana consumption. They're pretty dosed out for a few days, and then boom, up they come, and things are not so awful. So the thing that is fascinating, though, is that we'd been treating my friend's dog for several months with acupuncture, herbs, and then a combination of medications when he needed them, including non-steroidal drugs and tramadol, which many of you guys may or may not have familiarity with. But the thing that's really fascinating is that after his exposure to an overdose of marijuana, he actually stopped needing his pain medicine, and he needed acupuncture less frequently. And then as a result, in South Carolina, it is not legal to have marijuana, whether that in any shape, fashion, or form. But we do have access to CBD oil and also to hemp. So the thing that's cool is that once my friend started our dog on some hemp herb, he still continued to have much improvement based on just eating that in his diet. He still gets acupuncture periodically, but he only rarely needs medication at this point. So that woke me up to the fact that I needed to investigate this a little bit more. There's a ton of hype out there right now in terms of marijuana and CBD, and there's a drug company that is trying to get a patent on CBD. And if this happens, then that changes the whole ball game, because once it becomes a prescription product, then you and I can no longer have free access to it over from a person that we trust to provide us good quality product. But that's a whole nother bag of wax. You can talk to the FDA about that one. But at any rate, so there's a lot of questions coming up about medical marijuana. And the first thing I want to explain to you is the difference between medical marijuana or pot and hemp or CBD. So CBD, which is a cannabinoid, that's what it stands for, is what's present in hemp. And it does not, what the amount of THC, which is the part of pot that makes you get high, so to speak, that's in hemp is extremely small, and so small to the point where it does not cause any intoxication, so to speak, from marijuana that you would get as if you were smoking marijuana or ingesting it otherwise. So CBD oils are simply oils that are derived from hemp. There are hemp granules, hemp powder, hemp, just raw hemp that's been standardized to give you a certain amount of CBD. And so that is something that is legal in this area, which you can have access to. And in fact, in this area, we've got a company called Palmetto Hemp Oil, I believe it is, that makes CBD oil. There are several companies that make CBD as well. Gracie wants to say hi. So she's getting really bold, as you can tell. She settled into life very nicely here. So that's kind of the cool thing. But back to, so then there's medical marijuana, and medical marijuana is just plain old marijuana. There's some strains that are somewhat standardized, and then other strains that are just sort of street weed, if you will. So marijuana contains both THC, tetrahydrocannabinol, and CBD, or cannabinoid. And so there is some sense of euphoria, obviously, that you or your pet would get if you ingest, smoke, or otherwise. I think there's even some oils and things of that nature that have been made out of marijuana. So you would get a high from the THC plus the benefits of the CBD, which some say are more important in healthcare issues. We've got a series of blogs coming out on the site, and I'll put a link to the latest one so you can kind of keep in the loop about this. And then again, I'll also put a link to Dr. Silver's course and Dr. Richter's course, so you've got some access to that. But just to kind of go through some of these benefits quickly, certainly chronic pain is a major place where medical marijuana would be used. Limping or lameness or arthritis issues, anxiety or nervousness, extreme fear of loud noises, so thunderstorm phobias, things of that, garbage trucks, that kind of stuff, things that would set pets off. And then restlessness, anxiety. So for some of these older pets that we think are experiencing sundowner syndrome, they would... we could often see some improvement in their ability to sleep through the night, and thus your ability to sleep through the night. Inflammatory bowel disease, nausea, decrease in appetite, things of that nature. And also seizures and convulsions, skin problems. Again, there's some link between skin problems and anxiety, which is kind of fascinating to me. And then, cancer, the malaise that many people and pets experience from chemotherapy. So there's a ton of potential benefits available There's Miss Gracie again. She wants to be a ham today and get on the broadcast. So there's a ton of benefits that are possible with medical marijuana and CBD, and I'm not trying to tell you that it's a panacea and that's all you need. I think what we've seen with our patients, aside from my friend's dog, is that it reduces meaning both THC and CBD, or just CBD, reduces the need for drugs, and in some cases can eliminate them, which is always awesome. Drugs are life-saving in the cases where you absolutely need them, but what they're not good at doing is taking care of chronic disease. And so that's really been my focus, is to find options to treat chronic disease and help you help your pets a little bit more. So I hope that's making sense to you. This is going to become a bigger and bigger issue. It looked like we were on a trajectory towards legalizing marijuana, but things are sort of up in the air with the new administration. So that's sort of what's out there. But keep looking at our blog for more information so that you can inform yourself about options and what's going to be the best and safest thing. Obviously, in states like South Carolina, medical marijuana is just not possible, and I'm sure that there are back channels away as a way to get a hold of some marijuana, but you do need to be very careful with pets, because there is a fine line between therapeutic and toxic levels. So kind of keep that in mind as you research that a little bit more. And I know we've got a few folks on the broadcast with us, and again, I'm sorry if you're asking questions because I can't see it for whatever reason. So that's what I know so far today about medical marijuana. A couple of other issues I wanted to talk with you about. We've had some folks emailing us, and I know that it's so hard and it's so frustrating when your pet is sick and you don't know what to do. I would love to answer questions for you. If you message us on Facebook, message us on the website, happy to answer those questions for you. Just make sure that, and I know that you're in the middle of it, you're going through it with your pet and frustrated, but I need a succinct question. I mean, I've had a lady, and my heart goes out to her. She's so brokenhearted about what's going on with her dog, and she's telling me about all of this stuff, but didn't ever ask me a question, and so it's hard for me to be able to help you. So, again, please ask us questions. Message us on Facebook. Put a post on the Facebook page. Go to the website, theoriginalcrockpetdiet.com. There's a contact form. If there's a blog post that relates to one of the issues that your pet's having, put a comment there and leave a question, and we'll get it answered for you. The last thing I wanted to talk with you about today is I know that we talked about the Holistic Total Body Support multivitamin that's come out, and a couple of weeks ago I asked to see if anybody could find the spelling error on the label, and it is the big gaping one. It's multivitamin spelled with 2 I's instead of an A. So, it's a label misprint. I love it when 4 professional copywriters go through my stuff and miss that, and then grab the product once it's arrived, and bam, there it is. And unfortunately, I signed off on it too, so it's one of those things. But to celebrate those little quirks that life sends us, I would love for you to try this supplement and see what you see with your own pets. And so if you want to try it, there is a buy one, get one free offer. And if you put in the code BOGO, B-O-G-O, space HTBS, Holistic Total Body Support, and I'll put that code down in the comment section. Put that in your cart or the coupon section before you go to purchase. You'll buy one product, whether that's the cat size, the small dog size, the 90 gram, or the larger dog size at 225 grams. Buy one and you'll get one free. And I want to get this product out there and start seeing how pets respond to it. What I've seen so far in my own pets and others that have been testing it for me is nothing short of phenomenal. The palatability, meaning do they want to actually eat it? Yeah, they love it. And I think I told you last week my friend Ashley's cat, Jack, was knocking Hunter out of the way to get to his multivitamins. So they love it because it is a glandular supplement. We're starting to see changes in how these guys are feeling, starting to see them improve in terms of chronic disease and things of that nature, because we're actually giving the internal organs the support they need to heal and get well. So that's what I know for today. I hope you are having an outstanding day. Now that the UPS guy has gone, everybody's back to chilling out. So there's Esau and Moose hanging. Here's the kitty still hanging out. I don't think they really budged at all. And then here's Miss Gracie settled back down on the sofa. She wanted to be part of the broadcast today. So hope you guys are good. And remember that your pet's best health starts in the bowl. Take good care, and we'll see you next week.